all of us know, now from doing this work for many months, just how important leadership is for us to be able to connect to the things that are most meaningful in our work, to feel like we're working in a safe environment where we can speak up and contribute and give our best, that we can bring our true selves to work, that we can work together effectively in our teams. For that, leadership is absolutely critical, isn't it, for us to create joyful workplaces. But this is not just about those who are in formal leadership positions. When we think about leadership for joy, each of us plays a role in leading, in our own particular way, bringing our own assets and strengths to the way we live our lives, the way we behave day to day, and that impacts on all of those around us. And we're really lucky to have with us today Navina Evans, Dr. Navina Evans, who's going to give us some of her insights on leadership for joy. Navina is one of the most joyful leaders I've ever had the privilege to work alongside. And I hope, Navina, you'll be able to give us some of your insights and thoughts today on how each of us in our roles can lead and behave in a way that helps us connect to the joy in work and help others around us connect to the joy in their work. Navina.
Hello, Happy New Year, everybody. And thank you for that introduction, Amar. I believe I've got 10 minutes according to the program, right? Yeah, okay.
You've got 15 now, Navina, because I've been really quick.
Okay, all right then. So I'll try and be quick, and maybe if I might have a couple of minutes for anybody's thoughts or reflections or questions as well. That would be great. So Happy New Year, everybody, and thank you so much for inviting me to be part of this conversation with you at the start of today's session. I'm Navina. I'm Chief Executive at Health Education England, and I know Amar, and I know some of you on the call as well from my current life, but also my previous life when I worked at East London Foundation Trust. I'm a child and adolescent psychiatrist, and I was CEO at the trust before I moved to Health Education England. And in my previous life and my current role, I learned a lot about how important it was to enjoy work and to enjoy your job, and to enjoy what you do. So I want to say a few things about that and maybe stimulate some conversation and discussion. Hopefully what I say will help to kind of maybe stimulate some discussion from all of you. I want to reinforce Amar's point about leadership being not just associated with your role or your title or your job, especially when it comes to leadership in enjoying work. In my experience over the years, some of the people who really have shown me and shown us all how to properly approach this concept about enjoying work have been the people who haven't got the title and who haven't got the so-called power. And what I love about leading for enjoying work is that the power to enjoy your work actually comes from the most unexpected places. And it is a truly wonderful thing. So why does this matter and why is it really important? There's statistics all over the place, there's data all over the place, but there's this kind of standard thing that we all spend, most people spend about a third of your life is spent at work. I think for many of you, and especially in health and care, and especially in the NHS right now, it's probably potentially more than a third of your life, if not physically, certainly emotionally and psychologically, is spent at work. So when you think about that, it is so important that actually what you do, you enjoy. We expect to have happiness and enjoyment in our personal life, in our leisure time, with our families and our friends. Why do we not have the right to expect that at work? So, okay. The second thing for me is that it matters hugely because we know, and there's plenty of evidence, and there's plenty of sort of, we can see it every day, that if you're enjoying your work, you can overcome barriers and you can find solutions in a much more effective way, and you are much more productive. And there's no other business, there's no other sector where I believe the responsibility and the trust that the people we look after and the people we serve put on us as individuals and as teams and as organizations to really look after them when they are feeling at their lowest and their most vulnerable. That trust that people put on us, is a huge responsibility. And so in a kind of really important way, looking after ourselves and making sure that we enjoy what we do so that we in turn can do the right thing is hugely important. So that's the second thing I would say. The third thing I would say is that I'm really interested in delivering value for money. And I will be really open about this. Again, the public, the taxpayer, you and I, we all put a huge amount of trust in us to use our very precious resources in a very responsible way. So waste is something that should be at the top of all of our minds. Now we also find, and in my experience, I've learned that waste is associated often with people who are kind of not performing at their best. We're not performing at our best. And all of us will find that we don't perform at our best when we are not feeling particularly motivated, particularly happy, and not enjoying what we do. And I'm sure you can all think of examples, I certainly can, when that is the way in which I found myself functioning at work. So then coming to this whole way in which what you're engaging in, which is a QI program and a QI projects coming together as a collaborative to share your work and to make this happen. I love the fact that you're engaging in this in a disciplined way, with some rigor, with some application of science, with the collection of data. And the skeptics will think, like, how can you measure this stuff? How can you measure, the impact of either joy or enjoying work, but also the impact it is having on what you do, how you do it, on the outcomes. And I think that that's a really exciting place to be. And it's wonderful to see so many of you involved in that work. So data and measurement, I think putting that rigor and discipline around it is also really, really critical and important. And I hope that there are still many skeptics out there. And I hope that many of you will be able to share this work, and that eventually we will be able to demonstrate how this actually makes good business sense. Okay. Now, I want to finish by mentioning a couple of things where I think that there's something really important for the future of our work together, and also the future of health and care, and why what you're doing right now, I think, is really critical. We're at a turning point. Many of you are here today, I'm really pleased to see, during a really difficult time in our work, with the issue with the pandemic, the pressures on our services. And we really need to think very carefully about how we want to be and how we want to deliver care and services going forward. And I think this is a crucial part of what that's going to be about. So I would ask you to take this work further and be really bold about thinking that what you are doing is also planning and thinking about how do we prevent and how do we guard against burnout? How does this work help with retention? How does this work that you do make sure that we do the right thing for staff experience, and that we do the right thing for patient experience, and we then do the right thing for patient outcomes, and then we do the right thing for population health, and be even more ambitious? How is this going to help to do the right thing to address health inequalities? So I think that this is a starting point for something that's really critically important about what we do going forward. And finally, there's something about us that feels a bit shy and a bit embarrassed to talk about joy or enjoying work. I hope that this group of individuals here and others, will become much more proud and bold about speaking up about the good things, and speaking up about the small things that we can all do which is within our control, to make a difference for ourselves, to make a difference for our teams, and then demonstrate the huge impact it has on the work that we do and the outcomes that we will deliver. Amar, I could go on, but I want to just give a little bit of time if anybody has any comments on what I've just said. Thank you so much.
Thank you, Navina. That's wonderful. Thank you so much. While we have you, it would be great if anyone would like to ask a question for Navina. So please feel free to either just put your hand up on Zoom or type something into the chat, and I'll invite you to put a question to Navina. I love the permission, Navina, for us to not be afraid of using the word joy, even at times like this. Who'd like to ask a question? And don't feel shy. You feel free to bring your true essence and the difficultness of this work to Navina, because Navina knows how hard this work is. Let's give a moment for some questions to come through. While people are thinking, Navina, one question for you from me, because the team at the college, the team of QI coaches, is supporting all of these teams with their work. And it is really difficult work. What advice would you give to teams about how to find time for this? Because I know you in your executive team found time to do this work too. So any tips around time, because that is a big challenge for many teams. Oh, you're still muted, Navina.
Thank you. So finding time is something that everybody will struggle with. And, you know, I remember people often saying, oh, I'd love to get involved in improvement work, but I just haven't got the time. And actually, when you think about it, improvement work helps you to manage your time better. So I think that one of the things is getting in our own mindset, in our own heads, that actually this will help release time. And that, I think, is a really important thing. The other thing is we can all just look at our day, you know, a review of our day and how we spend our time, and being really careful and disciplined about it. And that is something, I think, is something that I certainly keep trying to do. And then one last thing is stop doing things that have no value, and be bold about that. Again, this is something that I really would love people to say, this has got no value for me, for my team, for my service. And we can still be safe, right? Because we're not irresponsible people. We can still be safe and you can still do the right thing, but we don't need to do it in that particular time-consuming way. We can do a whole thing about using time wisely, can't we?
Thanks, Navina. A question coming through from Erica. Erica, do you want to unmute and put your question to Navina?
Hi, Navina. Thank you for your talk. That's really informative and lovely. Thanks so much. I just had a question about, you mentioned something about retention, and I've actually never thought about joy and retention in that way before, because if you, the psychological factors of retention, might it be possible that, you know, if we have more joy, it might lift our motivation, it might lift our happiness in the role, and that's also kind of part of retention factors?
Yeah, thank you for that, Erica, and for making that connection. So if you look at exit interviews from people, which I think exit interviews are very interesting and informative, but they're a bit too late, aren't they? And you know, some people leave because they get promotion or they move house or whatever it is. But if you're interested in why people say they want to leave the profession, which is very distressing actually for all of us, but also, and there's plenty of data here, but also the organization or their team, and you pick through feeling valued, feeling that you're like banging your head against a brick wall, that you're not, and all those things are related to joy. And when you think, if you use this methodology and you do work in a systematic way about, especially in a team, then you will, you know, those little things that get in the way, the pebble in your shoe or the big blooming rock in your shoe, you can actually start to make a huge difference. You all don't do this job for bonus or big sums of money or anything like that. You do it because of the joy it brings you and the personal satisfaction and the pride a lot of the time. Yeah. And so why don't we want to invest our effort and energy in harnessing that? And that is about retention. Now, there's a whole other thing about burnout as well, which is connected to retention and connected to people needing to stop or leave their jobs. And burnout is absolutely directly related to joy and how you feel about work.
Thanks, Erica. One last question from Mark. Hi, Mark.
Hi there, Amar. Hi, Navina. Can you hear me okay? Great. So yeah, my question was really just thinking about, I guess, not thinking about joy at work in isolation of people's lives, and just kind of, how do we bring in attention to the enjoyment that people are having in their lives outside of work? How much responsibility have we got with respect to that, in terms of how can we expect people to enjoy their work if they're not enjoying their lives?
Gosh, Mark, that's a really, I thought you were going to be talking about work-life balance there, but you've actually taken a slightly different take on that. Interesting. I've not really thought about it in that way, actually, and I think it's a really important point to ask. I suppose just off the top of my head, how would I consider that? So it's also about what we get out of work, isn't it? In terms of a feeling of validation, self-worth, reward, which is not financial compensation, but other forms of reward. And when you work in health and care, a lot of us, we talk about that aspect of it, especially those of us who are closest to the point of care, supporting people, patients, and others. So, there is something about what we get and how we develop as individuals from work. But I would also say that there's something about looking after the whole self, our whole selves. And one of the things to be careful about or to be mindful of is that if our personal lives are we stressed or are difficult, that it is important for all of us to perhaps look after one another in a way that makes sure that work is supportive environment rather than one that adds to that difficulty, whatever it is. We may all go through some difficult times from time to time in our own personal lives. And that's also something that is quite interesting when you look at work around joy. One of the things that I've been doing with my team right now is actually bringing in, the ability to say, especially during the pandemic when everybody was working from home and childcare and exams and all sorts of things, that actually this week's really stressful because, one of my team was saying their daughter's really worried about they couldn't do exams and what was going to happen, and it was causing them a lot of stress in the family, and that might have an impact on how I am at work. And I think that's really important. It's okay to say that, and it's okay to look after one another. When you're saying, I've got a sick relative, I'm really preoccupied about them, whatever it is, and can you give me some slack this week? Those sorts of examples I think are really important. But also, I don't want to share. That's also okay. And the final thing I'll say there is that the importance of staff networks as places where staff can kind of staff networks are safe places to raise, life as a whole, and what that means for us at work.
Thank you.
But I think that's I'm interested to explore that a bit more, Mark.
Yeah, and I was just thinking, I've done a bit of very introductory work around trauma-informed care, and one of the conversations that was had there, that there was kind of an idea put forwards that people that come and work in healthcare often are people who are quite empathetic and understanding, and they get that empathy and understanding from their own personal experiences of trauma.
Yeah.
And so we may have a cohort of staff that have experienced trauma, which is what brought them to the to the profession and the caring profession in the first place.
Yeah.
So it may mean that they have got complexities, they have
Yeah.
got things that are currently or have gone on in their lives in the past
Yeah.
that may make it more difficult than for them to get enjoyment out of life.
Yeah. Yeah, absolutely. Interesting to think about. I've not thought about it that way.
Thank you.
Thank you.
Navina, if you're okay, we've got one other question, which I think would be a really good one to put, because many teams will be facing this. Rachel, I wonder if you're willing to unmute and put your question to Navina.
Yeah, I was just asking about how you deal with those issues which seem to be constantly there, but seem to be kind of out of people's control. So there are larger issues around like lack of staff parking, difficulties getting equipment, and it's kind of the basic stuff, and you can put all the other additional nice things in place, but if staff are still struggling with not being able to park their cars, it makes everything else seem a little bit superficial, but there just never seems to be an easy solution to it.
This is so frustrating, isn't it? It's like these are simple things that we can do in organizations. Parking, bit of hot food, tea and coffee, and yet there's something about us that seems to get in the way, and some organizations can do it. So what's the thing that you can do around this? This has been raised so many times, and so I'm going to tell you a little story, and then I'm going to give you a potential for what you can do, what we can all do. There was a trust that I used to work, not our trust, a different trust that I worked with, where they did free staff parking, car parking. And it was in the same ICS, STP. And that chief exec, fantastic. Everybody thought, great idea, okay? And the hospital a few miles down the road, I was at a meeting where the chief exec of that hospital gave him a really hard time because he said, you've gone and given your staff free car parking. Now my staff are having a real go at me, okay? And I sat there and I thought, well, why don't you just do free car parking then as well? It's like so easy, is it not? If he can do it there, you can do it there. And yet there's something that stops people from thinking imaginatively and proactively. So this comes back to how do we make a case for something? And this comes back to collecting data, value for money. And what he worked out was what he was going to get in terms of the cost of the free car parking and the return in terms of, you know, time, claim, whatever, everything else. You can put a cost on the staff joy and motivation. And it worked, and he worked out that it was more beneficial for him. Now that's a smart leader, and that is about leadership. I wish I could share his name, but I'm not going to. I'll leave you to work that one out. I think what we all need to do is, coming back now to my old chief exec days, what would I have liked if a member of staff came to me and said, you know, why won't you give us free car parking? And then I go and I talk to estates, and I talk to the chief finance officer, and they says, oh, it'll cost you £3 million. We haven't got £3 million. So I think something that you're learning that helps to present the case in a way that says, for this initial outlay, you're going to get this kind of return from us. Maybe that's a different way of getting into the minds of the people that are going to make these sorts of decisions for you. And then finally, I'll say you will have people like me banging on and on and on about why, honestly, just do the car parking thing. Okay, I will promise I'll keep raising that issue on all of our behalf. Thanks.
Thank you.
Thanks, Rachel. That's a fascinating answer to a really meaty question, Navina. Thank you very much. It comes back to what you said earlier about value for money, and sometimes people struggle to make the connection between staff experience and joy in our work and value for money at a bigger scale. But actually, there is such a connection to it, as you've helped us see today. And actually, sometimes when we're advocating for change that's outside of our influence, we have to think in terms of those who are going to make these decisions and help make a business case for it, and use the learning from this program, use the data around people's experience, people's burnout, retention, the opportunities that joy can bring in terms of additional value for our service users when the team is feeling joyful and in a place of creation and optimism. I think there's plenty for us to do. And it all begins. God, sorry, Navina, go.
No, I was just one last thing to say about value for money. We sometimes, this is a criticism of us all collectively in the health service. We don't like to talk about value for money because we think it means cuts, or it means doing more for less, things like that. But I think we need to commandeer that term and that concept and make it work for us. And the smart way of doing that is actually demonstrating that this is good use of resources, and value for money is actually something that we want to own, and it's not something that's being done to us by somebody else. I'll shut up now. Thank you so much.
Thank you, Navina. Thanks for supporting the Health Education England teams who are part of this fantastic program, and thanks for sharing your wisdom, the pearls of wisdom, with the group today. This is, I think, the biggest collaborative on joy and work that's been done so far. So there's a ton of learning for us all about what it takes to really do this at scale, and we're really grateful for your insights and support with it, Navina. Thank you so much for your time today.